A patient is rushed to the ER. Her hands are uncontrollably shaking, her heart is pounding out of her chest, and she's finding it difficult to breathe. Blood tests reveal that she has acute liver injury, and upon further investigation, it was found that her liver injury was the result of taking a supplement called Hydroxycut. Unfortunately, this was not the first nor the last time that Hydroxycut would be linked to such cases of liver injury or other serious side effects. Hydroxycut is one of the most popular weight loss supplements in North America, and as a result of multiple cases of serious side effects, including one death, their formulation has gone through some changes over the years in an attempt to stop these cases. Unfortunately, this has not completely eliminated the problem, and Hydroxycut is still causing serious health issues to this day. But how effective is Hydroxycut for weight loss? And how do you know if it's safe for you to use? We're going to create a series of videos that looks at the whole Hydroxycut family of products. So subscribe and hit the notification bell to stay up to date. In this video, let's start by taking a look at Hydroxycut Original to see if it's worth your money, see if we can replicate it with a cheaper and safer alternative, and give it an overall rating. Let's take a look at the ingredients. Here are the doses per capsule. The recommended dosing is 2 capsules 2 times a day, so that's a total of 4 per day. This is the most basic version of Hydroxycut, and in the US, it's simply called Hydroxycut Original. In Canada, it's called Pro-Clinical Hydroxycut, and both are exactly the same product, just that in the US version, some of the ingredients are hidden, whereas all the ingredients are listed in the Canadian version. Hydroxycut also has another version called Hydroxycut Non-Stimulant, which is basically just the original version with the caffeine removed. By the way, if you want to hear about our review of any of the other Hydroxycut family of supplements, I'll link those videos down below in the description once they come out. Whenever supplements add ingredients into their product, there are 3 very common issues with many of these ingredients. One is that the doses they use are way too small to be effective. 2 is that the types of extract they use are ineffective and don't contain much of the active compounds. And 3 is that the ingredient itself has not reliably shown any beneficial effect in humans. When we analyze all these ingredients, we're going to see which one of these issues they have. Vitamin D plays an important part in metabolism. Evidence from observational studies suggests that obesity is associated with low vitamin D. So if you are deficient in vitamin D, taking vitamin D supplements may support your weight loss progress. However, if you have sufficient vitamin D, taking extra vitamin D is not going to help you lose more weight. This is an important distinction you should understand. Just because a nutrient is involved in metabolism and supports weight loss doesn't mean that taking more of it will speed up your weight loss progress. It's more like if you don't have enough of it, it might slow down your weight loss progress. But once you have enough of it, it's not going to have any more effects on your weight. The same goes with the B vitamins. They're used by our bodies as a part of our metabolism by helping to convert food into energy. But supplementing B vitamins above and beyond what we need won't help you to lose more weight. Although, like I said, deficiencies can make it more difficult for your body to burn fat and slow down your weight loss. Some diets, like vegetarian and vegan diets, often supplement B12 since those diets are naturally low in them. Regardless, the B vitamin doses provided in Hydroxycut is way too low to be useful, and I'd recommend taking a dedicated B complex supplement if you were truly deficient. Green coffee bean extracts and the chlorogenic acid they contain appear to have some minor effects on fat metabolism. How exactly they help with weight loss is debatable, and most of their weight loss effects are likely due to the caffeine content helping to improve exercise, rather than the chlorogenic acids. Regardless, the overall amount of weight typically lost is pretty modest, with people losing on average 2 to 4 pounds over a few months. That's not very impressive, unfortunately. I've talked about green coffee beans for weight loss before, and I'll link the video down below in the description. There are a lot of claims around apple cider vinegar's ability to help with weight loss, most of which are not well substantiated by the evidence. Its most likely benefit has to do with the acetic acid contained within, which may modestly help control blood sugar levels. Unfortunately, this effect is only possible with large doses of apple cider vinegar, or even regular white vinegar, anything with acetic acid really, and the 200 milligrams that Hydroxycut provides is not nearly enough to do anything. Again, I've talked about ACV for weight loss, and I'll link the video down below in the description. Eating plums and the soluble fibers they contain may be helpful as part of a weight loss diet to help manage hunger and appetite, but are not useful in supplement form, especially at the tiny doses Hydroxycut uses. Baobab and cardamom are both plants and herbs used traditionally to help with diabetes and manage blood sugar control. There isn't really any good evidence that it can actually do those things. Nevertheless, herbalists use many grams of these herbs for it to be useful, and the tiny doses that Hydroxycut provides isn't going to do anything anyways. The vast majority of Hydroxycut supplements rely mostly on caffeine for their effects. This one is no different. Caffeine's effects on weight loss are primarily as an exercise aid to help people to increase the intensity and duration of their exercise. This version of Hydroxycut provides at least 400 milligrams of caffeine a day with their max recommended dose, and probably more due to the undeclared caffeine content in the green coffee beans. This is the equivalent of about 7 shots of espresso. That's a pretty high dose. It's important to note that having more caffeine in a supplement is not necessarily a good thing for weight loss and can be harmful for some people. Caffeine affects different people differently, and the ideal dose of caffeine is highly dependent on the individual. Some people do better with smaller doses, and some people require a larger dose to feel its effects. But having more caffeine doesn't necessarily mean more energy or better exercise. In fact, too much caffeine in a more sensitive individual is counterproductive to their weight loss and exercise efforts, and just leads to more negative side effects like anxiety or heart palpitations rather than improved energy. And unfortunately, Hydroxycut products do not have a very good safety record. Prior to 2004, Hydroxycut used to contain the ingredient ephedra, and there were reports of seizures in people taking these products. As a result, thousands of lawsuits were filed against the manufacturer of Hydroxycut, and in 2004, the FDA banned the use of ephedra in supplements. Hydroxycut then reformulated their products to contain a number of other herbal ingredients. It was then that a number of serious side effects related to liver injury, including at least one fatality, was linked directly to Hydroxycut. The FDA then issued a warning in 2009 and recommended that consumers discontinue use of Hydroxycut. Then in 2010, the FTC fined the makers of Hydroxycut for $5.5 million for falsely advertising that its supplements could help consumers lose weight. Hydroxycut then carefully changed their marketing language to comply with the FTC and reformulated it again so that the primary active ingredient of their supplements was mainly just caffeine. Hydroxycut no longer contains ephedra and has removed a number of herbal products that were suspected to have caused liver injuries in the past. However, case reports continue to link Hydroxycut to other serious side effects like heart and gut issues. And in 2020, the rapper Daniel Hernandez, also known as 6ix9ine, was reportedly hospitalized after consuming 2 Hydroxycut pills with a coffee. The abnormally high dose of caffeine in Hydroxycut likely contributes to the continued case reports of serious side effects. So, if you're sensitive to caffeine, have cardiovascular issues, suffer from anxiety disorders, or are taking other stimulant drugs like phentermine, you need to ask your doctor to see if it's safe to take. I would also avoid taking it in the evening, or it might cause insomnia, and I would definitely not exceed the maximum recommended dosage of taking 2 pills at one time, or a max total of 4 pills a day. It's also not safe for pregnancy or if you're breastfeeding. Taken together, Hydroxycut Original is primarily an exercise aid and stimulant, mostly due to all that caffeine, and its effects on weight loss depend highly on whether you're exercising. So Hydroxycut may help if you're actively increasing the intensity and frequency of your exercise and burning more calories as a result. However, if you're not physically active or exercising seriously, just taking Hydroxycut won't do a whole lot, and you may not really notice any benefits. At the core of it all, Hydroxycut Original is basically just a high-dose caffeine pill with some added vitamin D and green coffee bean extract. At the recommended dosing of 4 pills per day, the cost depends on where you're getting it. For the American version, each bottle costs $20, and there are 72 pills per bottle, so a monthly supply is going to cost around $34 US. For the Canadian version, each bottle costs $27, but there are 100 pills per bottle, so a month's supply is going to cost around 33 Canadian dollars. Compared to if you were to just get caffeine tablets, that's around $2 to $3 a month, vitamin D, that's $1 a month, and green coffee bean extract, that's about $8 a month. And you can essentially recreate what Hydroxycut Original provides for around $11 to $12 per month just by supplementing the key ingredients individually. Rating Hydroxycut Original or Pro-Clinical by effectiveness for weight loss, I'm giving it a C. It basically works as an exercise aid, and taking it without increasing your exercise is not likely going to have much effect on your weight whatsoever. Rating it by cost, I'm giving it a C. It can be essentially replicated by getting individual ingredients at a cost many times less. Rating it for safety, I'm giving it a D. There are direct case studies of people experiencing serious side effects from taking Hydroxycut, including one death. Also, the high caffeine content makes it unsafe for certain people to use. Overall rating, I'm giving a D. I would not recommend it at all. Hi, I'm Dr. Brian Young. Do you think it's worth it? Let me know in the comments down below, and if you found this video helpful, please subscribe to the channel and leave me a like. Hit the notification bell if you want to stay up to date, and share this video with someone you know can use the info.